How can lymphoma chemo damage your veins? How can chemotherapy for lymphoma damage your veins? This is an important question for anyone undergoing treatment. Chemotherapy is a common treatment for non-Hodgkin lymphoma, and while it can be effective, it can also have side effects on the veins. One of the main ways chemotherapy can damage veins is through direct injury to the lining of the blood vessels, known as the endothelium. Certain chemotherapy drugs, especially those classified as vesicants like doxorubicin, are particularly known for their toxicity to these cells. This toxicity can lead to constriction of blood vessels and irregularities in their walls, which can impair normal blood flow and the overall integrity of the vessels. The damage may begin shortly after the administration of the drugs and can persist in the affected veins. Another significant concern is a complication called extravasation. This occurs when chemotherapy drugs leak out of the vein into the surrounding tissues. Vesicant drugs can cause serious tissue damage in these cases, leading to symptoms such as pain, burning, redness, blistering, and even tissue death at the injection site. Extravasation often happens due to issues like vein puncture, fragility of the veins, or displacement of the catheter used for administration. It is crucial to address extravasation immediately to prevent severe local injury. Infiltration is another vascular complication that can occur. This happens when chemotherapy fluid leaks into surrounding tissue without the severe damage seen in extravasation. While it may not cause as much harm, infiltration can still lead to swelling, discomfort, and potential infection. The damage to veins and surrounding tissues from chemotherapy can arise from both the chemical toxicity of the drugs and mechanical factors related to how the drugs are administered intravenously. Some chemotherapy agents may also trigger vascular spasms, which can further compromise blood flow. In summary, chemotherapy for lymphoma can damage veins by injuring the endothelial cells lining the vessels, causing constriction and wall damage, and by the accidental leakage of toxic drugs into surrounding tissues. This can lead to pain and tissue injury. Careful administration and monitoring during treatment are essential to minimize these risks and manage any complications that may arise. Always consult with healthcare professionals for personalized advice and to ensure safe treatment practices.